They're both different types of growths that can happen inside of the uterus, but in general, polyp is really kind of a small type of growth that happens only in the inner lining of the uterus, as opposed to a fibroid that happens in the muscle layer of the fibroid. In general, fibroids are benign tumors, non-cancerous tumors that kind of grow inside the meat part of the uterus, whereas a polyp is more like a little tiny mushroom or skin tag that kind of grows in the lining of the inside lining of the uterus. The polyp can become cancerous at some point, and that's probably the main thing, that when you have a polyp, even though the symptoms can be similar, which is excessive bleeding and even pain, polyps are something that you want to be careful with, because you want to get it biopsied and you want to be sure that it's not cancerous. Those are the two main reasons. The other big differentiator is fibroids are way more common. About 80% of all women will have fibroids. Most of them don't even know that they have fibroids. Polyps, on the other hand, are not that common, and so when somebody has a polyp, you want to be a little bit more careful in making sure you get a biopsy, making sure it's not cancer. But they are growths, so both are different types of growths that happen inside the uterus, but they're very, very different. That they're different types of tissues. The polyps just involves a little lining inside of the uterus where the baby kind of attaches, so to speak, whereas the fibroid grows in the meaty part of the uterus, and it's a completely benign condition.